Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi, Dr. Darrow.
Hello, Nita Valens. You're looking gorgeous today, as usual.
Why, thank you. I put on extra makeup just for our listeners.
But you have a good natural look, too.
Why, thank you. And you look great with your hat on and all your accoutrement all around you, and we're going to help a lot of people today.
You know what? I can't wait to do that, and I've been doing this work now for, God, it's been like 1997.
Wow.
That's when I had a lot of hair on my head. Yeah, I actually started doing this musculoskeletal type of pain with Actually, it wasn't platelets and stem cells back then. It was dextrose sugar water. And people go, how could sugar water help? And it's easy because it creates inflammation where you inject it, and inflammation brings fibroblasts. And fibroblasts in the body are the cells that grow the tissue. So for injuries, and I was doing this at UCLA in my residency, and a lot of doctors were unhappy with me that I was doing that because they didn't know what it was, and they were used to giving the three things that we did when we were in residence at UCLA was we sent people to physical therapy, we gave people strong medications like narcotics, and then when that didn't work, which it usually didn't, we would send them to what?
Surgery, elective surgeries.
Right, but it wasn't really elective because the patients didn't know it was elective. They would do what the doctors told them to. And I would always get in trouble going, why don't you try this other thing first and see if you don't need to get surgery? And it started working. And then I started my practice, and that's what I've been doing ever since. So it's been a great run. I've used this on my body for all those years and had a great time doing it. Now, I didn't mean to cut you off, Nita, because I know you have some other stuff to say, like, what is our phone number so you can call us right now?
866.
No, you don't get to say it,
Oh, okay. Go ahead.
It's Boys' Day today. It's backwards
Oh, my
day.
gosh.
So please call me here right now. Make it interesting for me. The phone number to the studio is 866-870-5752. Go run and get your pen or pencil. If you're driving and listening, pull off to the side of the road, get off your Bluetooth so we can hear you very well. But the number here to the studio, live and local, as Dr. Jean used to say, 866-870-5752. And if you catch the show at some weird time, sometimes they play it at other times when I'm not there. So do it while I'm live here. So it's 866-870-5752. But if you do catch this at an odd time, or if you're too shy to call up, you can go right to the office number, and that's a very simple number to remember. It's 800-300-9300. That's 800-300-9300. And one more bonus for you is I have a very, very complete website. I work on it every single day, write articles on it that will help you learn how to save yourself from having a needless surgery. And I say needless because most of the orthopedic surgeries that are being done today for musculoskeletal complaints, and that's knees and hips and shoulders and necks and backs and toes and arthritis and all that stuff, in my humble opinion, should not be done. Okay? That's a bold statement, and it's not a statement against the orthopedic surgeons because I adore them. They are the tough guys in medicine. They do the hardest work, and unfortunately, I see a lot of their patients that have had a failed surgery. That means a surgery that came out without getting better or got them worse. I see infections. I see things where knees are what they call gutted, where they take everything out of them and then get them ready for a knee replacement, which I see fail so much of the time. It can be very positive and it can be very negative. I'm not a gambling man. I don't go to Las Vegas. If you're a gambling person, go get a surgery. It may come out okay and it may not. And then a lot of the surgeries come out okay for a while, and then they seem to break down after a period of time. So,
well, you have one more surprise for people. You forgot the free book.
I know. Thank you.
You're welcome.
You're my good backup girl there.
There, see? It's not totally Boys' Day. It's 95 and 5% Nita. Yay!
Yay, Nita. So the book that I've written is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's free if you call in right now. It's a $25 book. Let me see how many pages. I'm playing with it right now. It's about almost 200 pages. It's got studies after studies after studies of why you should consider what we call regenerative medicine using platelets and stem cells versus why you should not be having surgeries. Now, if you got a broken bone, you better hop over to the surgeon as quick as you can. Get to the emergency room, whatever you need to do, and get it fixed. But most of the surgeries that are done today for orthopedics are what we call elective. That means you don't have to do them, and the patient should have the right to decide if they elect to do it or not to do it. But that's not the way it goes. They get pressured into these surgeries that are just not working very well. And then they're a setup for another surgery. And then, if it's a knee replacement. If it's a shoulder, it's a shoulder replacement. And I don't see those surgeries working out too great. Now, to get some calls in here to make my life interesting, I am going to punish Nita.
Oh, it's joke time.
Yep. So if you want to save Nita, give us a call at 866-870-5752. You can talk to me. So, Nita,
yes.
I went to a very emotional wedding. Do you know why?
It was emotional because there was a river running behind it.
No, come on. You're too smart for something like that. It was an emotional wedding because even the cake was in tears.
Oh, that's a good one. That's a good one.
Okay, when is the best time to go to a dentist?
When your teeth are perfect.
When you're 230.
230. That's a good one. I like that one.
Isn't that cute?
That is very cute.
By the way, a lot of my patients send me these jokes, so don't kill the messenger.
Oh, no, I understand that.
I'm going to hit you with one more because
okay.
You put your genius. I know you have a very high IQ. What do you call a farm that makes bad jokes? Corny.
Oh, my God. Okay, so here's the thing. I do have a high IQ, but it doesn't kick in till, a couple hours later.
After coffee.
About 5 cups of tea.
I'm going to give you one last chance. Okay?
Oh, my goodness. Okay.
What kind of streets do ghosts haunt? Dead ends.
Oh.
I have to do all the laughing for you today. A couple other things that we do in the office, which men and women both do, is the vampire facelift, which is injecting the face with platelets or stem cells, and it thickens up the collagen. All that we really do in the office is stimulate new tissue to grow. That's how we heal the musculoskeletal system. We don't cut tissue out. And the same thing can be done on the face with the vampire facelift or the vampire facial. And then we can actually stimulate hair follicles to regrow. And I was reading Tony Robbins' new book, Life Force, which I admonish everybody to get. It's a great book. I think there's a little bit of frou-frou in it, promotion, blah, blah, blah. But there's good information. I just read about actually it's Medicare approved, a way of healing Parkinson's disease. Okay, it's an ultrasound technique, non-invasive, no holes drilled in the skull. And I have a ton of Parkinson's patients, family members, whatnot. So you learn things like that. He talks about different corporations that do this bioscience work that he invests in. So that might be another thing for you investors out there. So I'm going to go to, since we don't have any callers yet, do we need to?
You want to give the phone number again?
Yeah. Number to call me, talk to me right now is 866-870-5752. So I'm going to go to a question. I get questions all day and all night. The website where you can email me is www.lastemcells.com, www.lastemcells.com. So let me drag out a question. Okay. This one says, bad hip bone on bone. Well, we already know that bone on bone doesn't usually happen, but I'll get into that. So bad hip joint x-ray show bone on bone. I am 85 years old. Don't want surgery. Can you help? Well, this is like every other question I get, every other email I get. I don't know what I can do until I examine your body. I don't care what an x-ray or an MRI or a CT scan shows. I like to have them. Don't get me wrong, because sometimes we find some extraneous materials. I took care of a rugby player from New Zealand. He flew in, got some treatments, and got healed, flew back home, played rugby, and I just got a email from him. He's coming back to LA. He was biking and he fell on his hand. Can I help him? So I got an MRI, and it showed something really weird. It's called an echondroma. Okay? You can look that up. By the way, any words you don't understand that I say, please look them up on Google, and then you can see a picture of them if you hit the term images on the upper left-hand corner. So you can actually see your own anatomy and see what's going on. So this is a benign bone tumor, and it's kind of strange that it showed up right where he banged his hand. But it's not a big deal because it's benign. Okay, benign means it's not cancerous or going to cause a problem. He just always had that. He just happened to fall right on it. So I can most likely help this, but I still have to touch the area to make sure that I'm doing the right thing, because we get a lot of what we call red herrings. The image will show something. Nita, you're breathing. That means that something's going on.
I was looking this up, and the images were a lot of detail.
Yeah, isn't that cool?
Yeah.
Yeah. Anytime you have an MRI or the doctor mentions something and you see the report, look up the words. Doctors are no smarter than you. They just have a language they use. We learn about 12,000 words every year in medical school. So it is a new language, but it's a language anybody can understand. You just look up the words on Google, and then if it's an anatomical part of the body, hit the images button, a menu button on the upper left, and you can actually see what it is, and you can figure it out. And then when you talk to the doctor again, you'll know a lot more. So let's get back to this question about a bad hip joint with bone on bone. Number one, I see bone on bone every single day with new patients, and most of them are not bone on bone. They were told it is because someone looked at an MRI or an X-ray, and the bones are closer together than they should normally be, because the cartilage that is on top of the bone, the articular cartilage, has been worn down. Now, a lot of these people I see with bone on bone have full range of motion of the joint. That means it's not bone on bone, it's smooth. It means that there is a surgeon who is thinking that they should do surgery, because that's the culture of medicine. There was a surgeon who was in my office for about 12 years. I rented an office to him, and he used to say, we never let the knife get in the way of a diagnosis. Meaning, he'd laugh when he'd say it, meaning, I'm going to operate no matter what it is, because that's what I know how to do. When you go to a barber, what do you get?
Haircut.
Yeah. When you go to a builder, what do you get?
New house.
And how do you make it?
With contractors and
hammers and
nails and
honestly,
and
yeah. So whoever you go to, you're going to get what that person does. Whatever that doctor does, that's what you're going to get. You come to me, and you're most likely going to get platelets or stem cells to help regenerate the tissue. Now, I do all kinds of medicine. I was trained at UCLA, so I have a very broad background in general medicine, internal medicine, every type of medicine. So when people come in for, let's say, a knee meniscal tear, I'm also looking at their general health. If they're overweight, I'm going to put them on a ketogenic diet. I love people to go on berberine, which is a supplement that's very much analogous to metformin, which is a medicine that people with diabetes take. It lowers the insulin. When your insulin is low, you burn the fat on your body. You actually eat your own fat. There are people that come in with, let's say, knee arthritis that they caused because they're overweight. Every pound on the tummy in excess is 5 pounds extra biomechanically on the knee. If you're 50 pounds overweight, 50 times 5 is 250 extra pounds on your knee, your ankles, your hips, and all that. So I work with people to lose weight when they need to, and I work with them on their hormones when they need to, which is almost everybody who's getting up in age, in my humble opinion, needs hormone optimization. Now, that doesn't mean I'm forcing anybody to do it. I have a booklet that I wrote about it that you can get by calling in today, 866-870-5752. And that book is called Age Management Medicine. So I wear a lot of hats. I love all kinds of things, and I love learning every day, which I do in medicine. Medicine is the love of my life next to my family. And I love my patients. Every patient gets my cell phone number. Can you believe it?
Yes.
And I get back to them immediately. I get texted all day long. One of the things I do is when I put people on a ketogenic diet, I have them text me every single morning with their weight. If they didn't lose weight, we find out why. What is it they were eating, and how much were they eating, and what's going on.
Boy, you're strict.
So, well, I ask them if they want to. I don't make them do it.
I know. I'm just teasing.
But yeah, I am direct with patients. I tell them what I think. I'm not there to put my arm around a patient and go, oh, honey, it's okay. Just go ahead and stay sick. I don't do that. I tell them the way it is. I'm honest. And most people like it. Once in a while, I get someone that gets mad at me saying, you're too direct. I need someone a little softer. And I go, fine. Tell me to shut up. I don't care. I do. I tell my patients when I start talking, one of the first things I say, tell me to shut up if I'm irritating you. Tell me to shut up if you think I'm too harsh. Because I'm here to do a job, and I want the job done well, and that job is to make you healthy, whatever it is. So I can usually help people that have hip arthritis, like this poor person, and not everybody can be helped. The biggest failure with regenerative medicine, usually platelets and stem cells, is not enough treatments. This is not a magical wand. I tell my patients that. They say, will this one treatment work? I go, I have no idea. I make them sign a consent for two things. Well, for many things. But one is there's no guarantees in medicine. No doctor should promise anybody anything, ever. Everybody's different. Everybody does different things. And the other thing is don't cheat on me. That means don't go exercising when you know and I both know that that's causing your problem. So give it a rest. Let it heal. Let the tissue grow. We do know from studies that the tissue grows after injections of platelets and stem cells. Okay? It's not magical. It just all makes sense. So let me see here.
Phone number?
Oh, Nita, you're so good. It's 866-870-5752. Call me now. You get a free copy of my book, and it's $25 value. And if you don't catch this now, you can call my office at 800-300-9300. Always go to the website to see if you like what I'm doing. It's just very simple. You walk in, get injections, and walk out. You don't need anyone to drive you. You can do it alone. www.lastemcells.com. And last night, I have a condition called trigger fingers, which is overuse of the tendons in my hands. And I play guitar, I play banjo, I play mandolin, I play golf. I'm injecting under a lot of pressure every day. I try to use very small needles, so it's hard to push. So I've got these two trigger fingers, my third and my first, which is my thumb. So last night I drove myself to a doctor buddy of mine, and he did what's called a hydrodissection. He and his wife worked together. which is numbing it up. So my hand was numb. There was a median nerve block, and then some lidocaine was put in there to numb the median nerve, which then numbed out my whole hand. So I had this procedure done. The hydrodissection is just blowing some fluid around the tendons that release them from what's called the A1 pulley in the surrounding tissue. I drove right home. It was kind of a traumatic procedure, as most people think about it. I loved it because I watched it on live TV. The ultrasound has a TV attached, which we have at our office, and you can actually watch these procedures happening. So I was pretty enamored with the procedure, and I drove home. No big deal. Same thing with the work I do, but you won't have a numb hand. I had to drive one-handed. Shh.
Ouch.
Wasn't a big deal. Was not a big deal. So I'm going to go to a shoulder question, if you don't mind, Nita.
Yeah, you want to give the phone number real quick first?
Yeah, baby. Give me a call right now at the studio at 866-870-5752. We love our callers, and you can use a fake name if you don't want anyone to know who you are. And instead of talking with your regular voice, you can go, "Hey, my name is Mark."
With a K, because you're Mark with a C. That's
right. So the statement on this question is low to moderate pain in my right shoulder blade area, bad MRI. Let's see what it says here. For the past few months, I've had occasional low to moderate pain in my right shoulder blade area. I would call that the scapula. That's in the back. It's not really the shoulder. I've taken a leave and used topical cream to somewhat relieve the pain. My internist ordered an MRI of the area. The findings of the MRI were worse than he and I suspected. He suggested I get several opinions from orthopedics for possible surgery. Now that's a mistake right there. You don't get several opinions from the same type of doctor because you're going to probably get the same type of reaction and diagnosis and then surgery. Let's see what else this person says. I mentioned PRP, and he said to include that as an option to avoid surgery. That's good. Always think of options that are conservative. Surgery is not conservative. PRP and stem cells are very conservative. While my MRI reports ominous, doesn't say what, I do not have severe pain and I want to avoid surgery. Well, that's a key right there. Many of the MRIs or X-rays or CT scans are ominous. I see them every day where they freak people out and they freak out the doctor and they go, "You need surgery. Look at that." And then you examine them and there's not really much wrong with them and they don't have much pain, if any. So isn't that kind of a conundrum? It is to me.
Yeah, basically.
So why
yes.
are you going to do an image to get a surgery? You don't operate on the MRI. And the biggest, to me, calamity in surgical medicine, and I ask this to all my surgeries, all my patients who have failed surgeries. I go, "Did the doctor touch you?" No. Why would they? They showed me the MRI or the X-ray. It looked terrible. Then I examine them, I touch them, and I go, "I'm sure glad you didn't get a second surgery. The first one didn't work." And a lot of times after the first one, they suggest a second one because there's not much wrong with you. So It burns me up. It really gets me angry. I am sorry. I love surgeons. I don't like the surgeries. It's different. I love the surgeons. I have tons of friends and patients who are surgeons. Believe it or not, surgeons actually come to me to get stem cells and PRP. And I don't do surgery, and they shouldn't be doing PRP or stem cells because they don't even believe in it. I haven't found one surgeon yet of my friends who believes it can work, but they still do it once in a while. And then when it doesn't work, because it's not going to work after one treatment. It can, but the odds are against it. We're rebuilding tissue. Hang with us. We're going to go to the break. And the phone number here is 866-870-5752. I would love to talk to you. Let's have some fun. And the website, www.lastemcells.com. Look it up. while you're at the break.
You're listening to Living Pain Free with Dr. Marc Darrow. We'll be right back with your calls, and we will pick up Aurora in just a minute, right after these messages.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.